patient, we need to take care of the patient, right? Taking care of the patient is the essence of medical tourism industry. But most important question comes in our mind, what does taking care means actually? What to do for the patient? And the question comes also again, Fayazi, you want to start a facilitator business, and question comes in your mind, why some facilitator and hospitals are able to cater to lots of patients and why not other? What are the key success points there? You are willing to provide the care, but how do you understand what is the care? Is it just being warm to them, just being helpful to them, or there is a strategy behind it? There is a thought process behind it, there is a science behind it, or there is an art behind it. How would you know it? And how would you know it what a patient needs when it comes to an international medical tourism? Patient within Tamil Nadu, within Kerala, you probably understand what are their needs. So Haji, how would you know that what are the needs I have to do? I have to take care of the patient coming from Middle East, right? So my job is here not only to explain you the touch points, and as I mentioned, every touch point will differ from geography to geography. If a patient from Europe, the documentation part will play more important role compared to African patient. Because African patient might not keep those records electronic and all. Yes, documentation is important for everyone, but he will not keep it. He won't go back and give it these papers to the insurance company or government. What about the US and European patient? Extremely important, isn't it, sir? Extremely important documentation part. But a European person might not have problem with getting the visa, might not have problem with the travel. There are lots of direct flights. But when patient comes from Africa, then conversion of money and all those things. So let's go back. Let's go to most important slides now. I have created this 7 C's of customer care. And these 7 C's of customer care can be in any industry, be it dental tourism, be it wellness tourism, Shashank, be it medical tourism, or even be it healthcare. So Midway Hospital wants to do just not international medical tourism, just for your own. These 7 C's play important role. However, because we are in medical tourism session, I will be referring term medical tourism again and again, right? When I say medical tourism, please do listen. If you are in dental business, consider it as a dental tourism. If you are in aesthetic and cosmetic business, consider it as a cosmetic tourism, right? Because the strategies remain same for medical tourism. So the 7 C's are, first we are going to talk about compassion, then care, then we are going to talk about communication, clarity, convenience, culture, and coordination. Take a time to take this picture. I will explain you one by one, but this photo is very important for you. Let's understand compassion. What is sympathy? What is empathy? What is compassion? Something happened to someone, you know him, and you feel sorry for it. So there is a grievance, right? And there is some bad thing. Then you pay sympathy to that person. But if he was your close person, and you also feel the same pain, so it's more like an empathy. So it's like a related, right? And you do something for it. But compassion is that you are making commitment that I will do something for his thing, is compassion. Dear Dato and Shashank, we are giving thousands of patient lead to Shashank, by the way, as a Namami Wellness Resort. And Drashti is in charge of the patient lead generation. And she knows one thing more than anyone in this room. Anyone, and trust me, I say it with confidence, knows in this room that why some people are able to convert inquiry into business and why others are not able to convert inquiry into business. We have been doing this business from 18 years and we are giving thousands of leads. We are giving thousands of patient leads to Turkey, to Dubai, to India and all. Trust me, not single hospital has the same way to approach. Many a time, Patient ask her what is the cost of knee replacement, ask her what is the cost of IVF, and if you reply, hey, the cost of knee replacement is $10,000, what are you doing? You are signing a death certificate of your business. Now, why I say that? The most important point is that any inquiry come to you, the moment inquiry come to you, the first job you are as a hospital, as a medical provider, is to show empathy or compassion. If you can show compassion, wonderful, but at least pay empathy. Feel for that person. Communicate with that person. Do not communicate just cost and price and profit. Baba Ranchoda said that profit will come. If you have seen 3 Idiots movie, he said, "वो जख मार के आएगा." Profit will eventually come, but you have to go behind quality and excellence. So compassion is the first thing that you need to do it in communication. I feel sorry that you are going through knee replacement, trouble, difficulty. Please tell me what happened, how it happened, how can I help you? And I understand that you're looking for knee replacement. I would definitely provide you the price, but I just want to let you know that with the price and package, we also provide you airport pickup, translator, the food quality that require, an excellence doctor, choice of, and we will provide you video consultation. A communication is required. If you are not able to provide these kind of empathy, sympathy and compassion kind of communication to the patient, and I see many patients lead goes just because, again, didn't we made this conclusion today that making a medical tourism decision is not easy? So patient needs more support than just only a quality healthcare treatment. And support is most important. And to start the support, you said, I want to provide care, Dr. Prem, and I would provide great care. Sangeeta, you would say, I would provide great care. But from where you will start? What is your starting point? Your starting point is an empathetic communication. Feeling sorry about the situation, being with the patient, understanding the issues of the patient. Even there is something called stated need and there is something called unstated need. You can't go and every time talk about all your needs. When he says, I need a knee replacement, right? He's asking you knee replacement, but what he wants travel, transport, knee replacement, follow-up care and everything. There are unstated needs of those patients which are attached to that. So when a customer inquires that I want a 14 days package to Namami for Panchkarma, right? So a 14 days package, he might be looking for Panchkarma, he might be looking for the vacation, he might be looking for a couple understanding. So every person who comes for that particular thing might have some other element also. A small communication with that, small conversation with that person can help you understand that why does he need it, right? What is the purpose behind it? Why? And then if you are able to communicate from that perspective. Some people want to come 14 days in a resort because they want to be at a relaxing places. Some people genuinely want treatment. There is a couple who want to build a bonding. So your communication differs and you can have that empathetic communication based on the need they have. So compassion is the most important component in medical tourism. If you do not have actually good solutions.